Okay, I would check my order. I would see that I would be doing a central line dressing. Once that I know that I was doing the central line dressing and I checked to make sure that my patient was the right patient per the order, I would knock. I would identify and greet the patient. I would tell them who I am. I would tell them the procedure that we were planning on doing today. I would get their general appearance, whether their clothes were neat and tidy, their speech, where they communicated, if they had any altered mental status. I would make sure that they were alert and oriented. I would make sure that they weren't childlike or anything like that. Once that had been assessed and they were fine, I would move on to the procedure. I would put a glove on anybody or a mask on anybody in the room. I would put a mask on my patient and myself. Once I did that, I would apply my non-sterile gloves. Once I had on my non-sterile gloves, I would then remove the bandage. Once the bandage has been removed, I would then put it in here. I would assess for drainage, any kind of leakage, any kind of blood, any kind of redness, swelling, anything that shouldn't be there. And if there was, I would put that in the documentation. And if there isn't in this case, so I'm going to continue on, I would remove my gloves. I would perform hand hygiene again. And then once my hand hygiene had been performed, I would go back to my sterile field. I would set it up so that way I didn't turn my back to it. My sterile field has been set up. I would then apply my sterile gloves. Once I had on my sterile gloves, I would then take my betadine or my alcohol first. I would clean around in a circular motion 3 different times, the entire size of the bandage that I intend to put back. Once that has been cleaned and done it 3 times, I would make sure that it dried completely. Once it has been completely dried, I would then repeat the same process with the iodine or the betadine, whatever I had on hand. Once that has been completed, I would then get my bandage, which would have adhesive to it. I would then put it back on top of the central line. Once that had been applied, I would get my clear cover. I would press it down, ensure that I didn't have any air bubbles. I would make sure that the line wasn't pinched or anything like that was going on under there. Once it had been applied, I would then take off my gloves and I would document who applied it, what time, how the patient, no, I wouldn't. I would just document on the central line itself. I would document who applied it, the time and the date. Once that had been done, I would then put my patient down in the lowest position. I would make sure all my bed rails had been lowered. I would make sure that they had a call light, that they were in good body position and alignment, and that they didn't need anything. Once that was done, I would make sure my hands were washed before leaving the room, and I would document the procedure. I would document how the patient took the procedure, equipment that I had used, any drainage present, any swelling, any pain, any discomfort, anything like that. Once that had been documented, then the procedure would be completed.